You're here because staying informed shouldn't mean drowning in data. Today, we're doing a deep dive into some recent U.S. government actions.
Right. Things touching on pandemic research and also how our medicines get made.
Exactly. We're pulling from reports by Bloomberg and CNN, plus statements made around a new executive order.
And our mission, as always, is pretty simple.
Yeah, just extract the key details and figure out what they actually mean for you.
Okay, so let's unpack that first big piece. This ban on funding for certain types of virus research.
Yeah. President Trump signed an executive order. It specifically restricts federal money for something called gain-of-function research.
And that's the kind where scientists, alter pathogens in a lab.
Right. To study if they become, more dangerous or spread more easily. Trump himself even suggested a possible link there.
A link to COVID-19.
Yeah, implying maybe we wouldn't have had the same crisis if not for that kind of research. He said, it could have been that we didn't have the problem we had.
Interesting. So what's the mechanism here? The order tells agencies like the NIH to basically find and stop any ongoing biological research that's seen as, well, risky.
A potential public health threat, yeah.
And looking forward, federal funding for research on viruses with pandemic potential, that's the term they're using, is prohibited.
Though the exact scope of pandemic potential isn't totally clear yet, is it?
No, that's still a bit fuzzy. But it's definitely causing some debate. Proponents say it's crucial to prevent future pandemics.
While critics are worried, right? Worried it might hinder important research we actually need to prepare.
Exactly, that tension. Understanding that is pretty key here.
And a big reason given is preventing accidental leaks from labs. We heard Health Secretary Robert F. Kennedy Jr. talk about that.
Preventing inadvertent leaks, yeah. He emphasized lab safety concerns.
And it's probably worth mentioning, too, that some Republican congressional committees have been pretty vocal, asserting a lab leak was the likely cause of COVID-19.
Pushing for a full ban on this research.
Okay.
And connecting that to the bigger picture, the U.S. intelligence community, specifically the CIA, reportedly identified a Wuhan lab leak as the most likely origin. That was back in April.
Adds context, definitely.
Yeah.
Even though Chinese authorities totally dismissed that idea.
Right. And the WHO, back in December, urged China to release all the relevant data they have on the origin. So this whole backdrop is clearly feeding into the administration's caution here.
Absolutely. Okay, let's shift gears a bit. Another big development is an executive order aimed at boosting domestic pharmaceutical manufacturing.
Yeah, the specifics aren't fully out yet, but the main goal seems clear.
Reduce U.S. reliance on medicines made overseas. Which brings up, questions about our medical supply chains.
Definitely. There's been growing concern about how concentrated pharma production is globally. And to push this, Trump also mentioned possible new tariffs.
Tariffs on drugs made overseas.
Yeah, an announcement apparently coming within 2 weeks. That is, make U.S.-based manufacturing more competitive financially.
Okay, so they want to bring manufacturing back. But what are the challenges there? I mean, is it easy to just ramp up domestic drug production?
Well, no, that's a critical point. It takes huge investment. You need the factories, the trained workforce.
Right.
And for some drugs, especially complex ones, the technology and the regulatory hurdles are pretty significant.
So it could take time and maybe even cost more initially.
It could, yeah. As the supply chains adjust, consumers might see some initial cost increases. It's a complex shift.
Definitely something to watch. And then, rounding things out, there was a promise of more action soon on lowering prescription drug costs.
Right. Trump mentioned a big announcement coming up about medicine costs. He used the phrase, we're being ripped off.
Okay. So quite a bit happening on the health front.
Yeah, so let's recap quickly. We've got this funding ban on specific virus research, gain-of-function stuff. Then there's the push for more domestic drug manufacturing, maybe using tariffs. And finally, this promise about tackling high drug costs.
These are definitely significant moves.
Potentially with some really far-reaching consequences.
And it's important, just to be clear, presenting these developments based on the reports. We're not, taking a side on the COVID origin debate or saying if these policies will definitely work.
Absolutely. Which leads to maybe a final thought for you, the listener, to chew on. Thinking about how connected global health is and how these pharmaceutical supply chains work. What could be the long-term ripples, the consequences of these U.S. policy shifts?
Yeah, something to definitely keep an eye on as it all unfolds.